and welcome you all back to our monthly Brainstorm Live. Sorry again for the late canceling of our meeting last month, but I appreciate y'all's patience as we try to keep the community moving forward and have some wonderful discussions as we do with Dr. Singh today. So I am excited to have some dialogue around Dr. Singh's work, and they have agreed to take it over from there. So Dr. Singh, you have our full attention. And as a reminder, we'll do about an hour formal, and then we'll break it down for some after hours dialogue if you all want to stick around. And Dr. Singh will also share some instructions about how they would like us to interact today. So Dr. Singh, take it away.
Thanks so much for the kind welcome and opportunity to share some of my reflections on a topic that's dear to my heart. It's one that I think we all sort of have been connected to at some level, maybe more acutely at certain points in our lives than others. But I would really love for us to have more of a conversation today rather than a didactic format. I have slides. I may get through them, I may not. And my goal is to share them with you afterwards so that you don't feel like you're missing out. And I can feel the satisfaction of knowing that I've shared things with you, including references that I think might be helpful. My goals, I show you my disclosures first of potential conflicts of interest. And what I hope we can do today is describe social neuroscience principles underlying the way that we engage and interact with our patients and families through psychiatric and psychological interventions. Hopefully describe maybe how we can reimagine our basic neuroscience understanding, studies that we do in animals and other model systems to inform us of how we as a species increase social resilience with context and cultural sensitivity, because as humans, we have those added elements. And participants, my hope will be able to identify at least one practical takeaway that I hope will enhance your practice and your interactions with your colleagues and peers. Really, the goal of this, I've shared the goals, but my intentions are a bit more meditated, let's just say. I want us to be able to figure out how we can use neuroscience research to inform ways to mitigate structural racism in our lives, in our communities, in our professional work. I would like for us to stimulate introspection about the nature and the quality of our interactions. And I say this in the field of medicine because that's where I come from, but really it applies in any context. I hope we can be part of a sustained effort to enhance culture of medicine toward kindness by presence and participation, and seek ways to make impossible conversations more possible. And it feels like this is necessary more than ever these days. And I understand that you received an article that I published a couple of years ago that was done in the context of a special call for papers that I co-edited with my colleagues, Dr. Olu Ajalor and Dr. Kristen Egstrand. Dr. Ajalor is at University of Illinois at Chicago, so I think we have some folks from Illinois here, and Dr. Ekstrand at University of Pittsburgh. And we were friends scratching our heads wondering what the disconnect was, and we're hoping to collate some information from the literature. And we're surprised to find that really some of the work that we thought, assumptions we made about work that we thought was out there really wasn't. And what are the gaps, and how do we facilitate new research in this area and break ground? But also to reiterate and reaffirm some things, basic principles that we've already learned through our evolution as human beings over the many centuries and millennia. And then my hope, if we have time, is to share a personal story that I hope illustrates a focus on kindness through stress and the life-saving impact of that action. And the guidance there is really everything that we relate to in life kind of starts with a story, whether it's a story a patient is bringing to you or a story that I share with you. It can have a deeper personal meaning and increase engagement and connection, but we should never, forget the amazing opportunity that we have in our work to access people's stories and use them as a way to help help them, to support them. And I love Malcolm X's quote here: "My sincerity are my credentials." The goal really is to try to take action and walk the talk and be able to use what we learn practically in our work. So in medicine, I know this is true again in other settings too, but again, I'll come from the place where I live. There's a huge lack of diversity in the field, and in just we talk about pipeline, and perhaps that has some evokes some different connotations these days. So my apologies for use of that term anymore, but the concept of, over time, when we think about the next generation of people who are coming into our professions, who's joining us, and how can we broaden reach? We're lucky because there's a huge amount of attraction these days to counseling and mental health services, and so we have an opportunity that we need to seize to be welcoming to a broader group of individuals, so that our patients can actually feel that they can see someone who looks and might have similar shared experiences like them. There's also a lack of structural framework for developing careers in mental health in an equitable fashion. So that framework has been built on the shoulders of previous successors, successful people who've done a terrific job setting frameworks, but perhaps those frameworks weren't built for everyone. So questioning that might be worth us introspecting. What about the impact of the focus of science and the problems we study? And I'll share in a moment sort of the disparities of funding, but it has a sincere impact on innovation and creativity and where we harness our most important resources. So how did we get here, and where can we go from here? If, symptoms of mental health, for example, start as early as in childhood, and we are suffering deeply with all sorts of social challenges in the world today, conflict-ridden challenges that potentially might take root very early in our development. Where have we come to an appreciation of preventing aggression, for example, or outbursts for behavior, for example, from evolving into something that could be potentially catastrophic for our societies? How do we prioritize that? And, I think there is some good and important discussion that needs to be had about gun violence and prevention strategies there. My hope is not to focus too much today on the politics, but though I think they are very important, but to focus more on the scientific lens, and how can we use data to our advantage to help facilitate policy development that could benefit our society to be less coercive and more cooperative. Here's a slide to show you what this disparity in funding looks like. Take a look at this graph. It's a little bit dated, but still has makes a point that I think is important to make. If you look at the years lived with disability, preferentially, you see that mental health really has a significant impact. But if you look at the research spent in US dollars on mental health research, it's quite different compared to the disability that one experiences from mental health conditions. Then if you look further at the years of life lost, that sort of also remains low on the totem pole. This is a mortality number. But if you think about it, how does mental health inform the rest of the things that are stacked on top of it? And we all know that the mind body is intimately related and that there are a variety of different mental health conditions, behaviors that can lead to cardiovascular risk, infections, cancer and neoplasms, respiratory and metabolic and endocrine abnormalities. So even though the years of lives lost may or may not directly be related to a specific mental health disorder, we know that the pervasiveness of mental health conditions across all body systems is huge. In fact, if we believe that there's a brain basis for most of the things that we see in our day-to-day practice, then the brain is the master commander of all organ systems in the body and is the most genetically determined and most complex organ in the body. So we ought to be shifting our understanding of how we see or stack or prioritize. In some ways, we need to do a better job advocating for how mental health impacts all of these body systems in a way that helps us, again, pool resources and appreciate the awesome opportunity of prevention through mental health intervention. I know I'm preaching to the choir here. I don't know that I need to necessarily pitch this sale to all of you, but I do want to kind of convey to you a language that I like to use so that maybe you could use it too when you interact with your patients and families and colleagues and policymakers and friends who might be in a room of influence that can potentially bring and drive this important point home. All right, so let's talk for a minute about what we know and what we don't know. Everyone's an expert. And excuse me, I'm getting over a cold, so I'm just gonna pardon my intermittent coughing. Dr. Beason said, "Would you like to introduce me?" And I said, "No, because you're gonna talk about all the things that I can do and have done. So what?" That's, kind of the way we've sort of done things. And it's the way that most grand rounds get introduced or speakers get introduced. It's fine. It's how we've built a trust or an assumption of knowledge. But frankly, some of that knowledge can be quite biased. And when we get to a position in our work where we love being right, love it. It's a social phenomenon, Don't you agree? You see, I'm doing it right now. I'm trying to get you to agree with me because what I'm saying must be right. It could be totally wrong. We don't love being wrong. We don't love being told that we're wrong. Miriam, did you want to say something? I noticed that maybe you had, okay. No worries at all. Please, anyone feel free to disagree and unmute yourself. And it is totally fine. I see some of you, but I have to also look at my slides, but I want you to feel completely comfortable, challenging my assumptions here too. So I say some of us just to be cautious. Not all of us love being right, but some of us for sure do. And you know those people, don't you? You know those people who love being right. And sometimes we're also too busy, need cliff notes. When I started Twitter, I didn't realize what this TLDR thing was, but someone explained it to me. It's too long, didn't read. Need the abridged version, Dr. Singh. Please don't give me an article that's 50 pages long to read. I don't have time for that. Maybe some of you have read some of the articles, aspects of it, dive deep into it, looked at the cross references. Maybe some of you have read the abstract. All good. We know what we know. We manage what we know and what we don't know in a variety of different ways. There's no judgment there about any of that. But what I would recommend is if you want to, kind of cultivate humility, if you feel that maybe you need some, or if you might want to find a different perspective, because it's nice to sometimes get a broader perspective. There's this great book by a New York Times author named Catherine Schultz called Being Wrong: Adventures in the Margin of Error. It's been out for a while, but it's a really great read. And it talks about the abiding faith of science in being wrong. We always, in our work, if we do any empirical studies and original research and we submit it to a publisher to publish, there's always a limitation section. You won't find an article that's an original work that doesn't have a limitation section. That's baked in because there's a recognition in science that there are always going to be limitations to what we do, that the scope of what we cover is always going to have some things that need more study or future direction. Even if it's a nature paper or a science paper or one that we think is highly impactful, you'll always find a limitation section. And that's, I think, an important point to illustrate about, turning our perceptions about the world into a different context. So there's knowledge by description. Okay, so this is the stuff that we all know quite well. It's what Dr. Beason would have potentially incorporated into an introduction. Knowledge and experience in academia that comes from a formal study, teaching, research, participation, dissemination, peer review, features that come from contributing and leading in all relevant activities of one's discipline. Okay, that's what we sort of kind of traditionally think of expertise. Is that expertise immune from bias, where new knowledge challenges how we traditionally think of things? When new knowledge comes up, it updates our thinking, right? So just because I know something doesn't mean I know it all, doesn't mean that I know enough. I'm here, I think, because Dr. Beason read something and invited me to share my experience putting it together and to hopefully provide some connections to you about my experience. I may have partially gotten it right. I may have certainly gotten it wrong, but that humility, I think, is an important point about balancing our knowledge by description. But here's another element, knowledge by acquaintance. And this comes from experiencing a phenomenon personally. Much of the research from the lens of systemic disenfranchisement is grounded in knowledge by description. And it adds a dimension, though, of knowledge by acquaintance. So many scholars who do research various types of discrimination have also potentially experienced being victimized or being impacted by being a member of a group that they study. This is also important. And it's when we're swimming in bias and we don't appreciate what we're reading or learning from someone, they're human too, and they've potentially had and bring to their work some knowledge by acquaintance. How do we think about people's work when we review it from these different lenses? Paradigm shift for some of you? I don't know, it was for me. And this came from an article that was written on publication ethics by the Committee on Publication Ethics that oversees a lot of just, should we be using AI when we publish our research? All sorts of questions that are really important, like people plagiarizing or retractions. This is a committee that sort of guides us on how to do, how to share and disseminate our research ethically. But they raised some important points in this work, that this discussion document that they put together on diversity and inclusivity, is that when we peer review for each other, we have these biases, and we've got to be very careful and cautious, and understand and appreciate that responsibility. Okay. So this, pipeline analogy, we're kind of going to get over and, think about it in a different way, but we can also appreciate that there are a lot of things that cause many scholars and many people in our field to leave. And there are a variety of different statistics that support that. Fields certainly, especially in the areas of mental health research, tend to be dominated by white cisgender men. The leaders and chairs of that field are mostly them. For others, there may be less access to resources. There may be implicit biases that prevail. And what people are left with is a sense of a lack of ambient belonging. Anyone heard of this concept before? So I'll talk about ambient belonging in a minute, but before I sort of go there, I wanted to just convey to you, like, this is sort of the scene. You've got as an example of gender bias in this field of, like, very predominantly male dominated in expertise field of medicine. You've got clotheslines that create obscurity, ironing boards that create, are like public intimidation and maybe even harassment, laundry basket kind of concepts or metaphors that people, it's like you have to kind of respond by folding people's feedback into nice, neat piles, and it's critical feedback. So you do a sandwich. What's a sandwich? Feedback with a sandwich, the negative and the positive, or positive, sandwich between negative feedback. Laura, did you want to say something?
Yeah, sorry, I was waiting until you got through the knowledge
few things,
piece
Yeah.
to make sure that I didn't preempt anything. But it seems to me you mentioned bias several times. I think that unconscious bias, implicit bias, combined with a lack of intention about self-awareness, it all comes down to that. And I think that that's part of our job as therapists, is that we really need to be aware of what's going on with ourselves, so that things that may be coming through, even though they're otherwise unconscious or non-conscious, will affect our work and affect our clients. So, I mean, even all this stuff that you're talking about, it takes a lot of courage, I think, to have self-awareness. If it's the whole idea of that we all have implicit bias, it doesn't mean if you have it, you're a bad person or anything.
No, right.
But a lot of people, it's a new idea for them,
Right.
and they get very defensive. So I think that when we talk about knowledge, it's also very impacted about stuff we're not even conscious about, that we've experienced for our whole lives. And it is it has an impact on the facts,
No doubt, Laura. And what I would say to that, that I wanted to convey in terms of expanding on a really important observation that you've made and others who are chiming in have made, that some of us need to do those feedback sandwiches. We need to neatly think. We need to, some of our worldviews are very entrenched, right? This is the concept of being right, where I wanted to bring in the example of being wrong as something that we do all the time. We're wrong a lot, and yet we don't know it. Unconscious bias is something that's part of our reality every day, but we don't, because it's unconscious, we don't realize it. It's in our social interactions that some of these unconscious biases come into our awareness. And so how do we then manage ourselves in that context? And so rehearsal through, literacy, through practice with social interactions are practical aspects that I'm going to talk about. But, it's so interesting to me that we have this scholarship around these concepts, and yet we turn around and we're meanies to each other in our own circles. Like, what happened there? What is the disconnect between theory and practice? I used to say before I had children, and I'm a child and adolescent psychiatrist, that I had all this theoretical knowledge. I was a charlatan, I was sort of just practicing with this theory, right? This knowledge by description, until I got additional knowledge, and it made me better. It made me a more effective therapist. And so these are things that I think are useful identities, useful sources of knowledge. Epistemology is the study of knowledge in philosophy. And I think it's useful for us to reflect on, where does that knowledge come from? Where do our assumptions come from? And how do we intervene on them in a way that is more comfortable, given that we've lived with a lot of knowledge that we've presumed to be right for a very long time. And so, we're racing against a lot of odds in many ways because we are the only ones doing certain things. And sometimes the structure of what we're trying to achieve is not built for us, and potentially leads to unfair expectations. So how do you change the table that you're trying to sit at when you didn't build that table? Or if it was built too high or too low or too something, do you build a new table? How do you get to that process? If you build a new table and then don't get invited to sit at it, what does that feel like? How do we cultivate empathy to be able to understand that this sort of existing stuff, intervening on it has been a real challenge. This is being right. This is how we succeed. This is how the world turns. This is how stock markets work. This is how, these are the assumptions we make about what it means to be right. Here's another point to make: the perils of opacity and partial information. So my professional profile picture for a long time was this picture on the left. It's not too aged, but it was actually a partial picture. I'm also a mother, right? I've got she's now older, but what happens when you just have part of the information of who a person is? And how does that impact the way that you interpret the science or the information that they're sharing with you? I think that there's an opportunity for us through open science to, oh, thank you, Henry. There's an opportunity for us through open science, through, to share our work in parts of the world that have never been exposed to mental health research. So they asked me a couple years ago to be a journal editor for this, the open access version of the Society Journal for the American Academy of Child and Adolescent Psychiatry. And I scratched my head and I was like, why should I do this? This is a lot of work. Why do this? I'm sure you all get asked this question, or ask yourself this question when someone brings you yet another curveball in your field, in your work. And I did this because I believe that if our work can go to far reaches of the earth, then maybe we can make more of an impact than we have been. Maybe our science will be taken more seriously. Maybe we can give people ideas in corners of the world that don't have access to the methodology or the research. And maybe we can actually bring them in to publish their work and disseminate it openly. What happens when open access journals start publishing openly available, freely available science? That science gets cited more. What happens to the authors that publish those papers? Their impact goes up. Their ability to drive expertise goes up. Why is that important? Super important for somebody who's starting off early, who might need that, who might need that invitation from Dr. Beason to come to share their work with others. This is the sharing is caring opportunity that we have. And the other piece to mention is that until we open ourselves up, we won't know the dimensionality of all of us, the various ways that we are diverse. And I urge you to take a look at this artist, Lee Wen, who kind of depicts the concept of intersectionality in their work. So in the article that Dr. Beason shared with you, there were some terms that were, sort of dropped in there that were meant to kind of get our conversation started about the science of social interactions or social behaviors. The concept of social resilience is kind of really interesting. Just as we would expect, social neuroscience is complicated, but I was really interested in understanding this because if there are methodologies that we have to implement in our work that actually can help us use words and language to describe certain phenomenon, then I want to know what it is. So what's social resilience? The example I want to share with you all is, have you ever been to Washington, D.C. in the Natural History Museum? There's an exhibit on evolution. And there's a segment in that exhibit where they show brain development. And the example I want to share with you is that they describe in this exhibit very beautifully how our brains as a species grew at certain very sentinel points in our evolution. Does anybody have any idea what those periods were when our brains actually grew in size, physically grew in size? What did we need to do to survive? It was actually, and sorry, more interest of time, but than anything else to move us along, but there's a very clear correlation between the time. Somebody's put something in the chat. Fire, okay, good one. So there we go. So we're starting to think about this a little bit more. The discovery of fire is an interesting concept, but and certainly that happened. But on a broader scale, climate has always been our enemy, and this has been true for all species. Turns out that the times when our brains grew the most were when we experienced on Earth inclement weather, really, really bad, climate disasters. Why do you suppose our brains grew during those times in history? It's because when we experience inclement weather, what are we doing as a species? We're warning each other. We're huddling. We need to figure out a way to help one another. We need to build social connections. Why are social connections so important and so complicated? It's because they're high order functions. They are functions that require a big brain. So not just opposing fingers that enable us to gather and maybe, strike to make fires and things like that, but we had to find a way to survive inclement weather. That's when our brains grew the fastest over the course of our evolution. How cool is that? Understanding that phenomenon and implementing that into our understanding of where are we now? Where will we be? Is the idea that with this climate change, are we going to huddle and scratching ourselves in the head and thinking to ourselves, wow, are we actually doing what we're supposed to be doing as we are, embarking on more inclement weather challenges? Should we imagine that we will huddle? Certainly when disasters happen, you've seen it all before. What do we do as a society? We find ways to help each other. We do it regardless, but then we're also causing war. So these are issues that we have to sort of understand and overcome. Are we doing this for pruning, for evolution, natural selection, as a la Darwin, or what? But these concepts of social resilience, affiliative behavior, prosociality. Prosociality is an important one I want to mention because it's the act of making a friend and keeping a friend. It's not just important to have a bunch of friends. And think about it in the context of digital and social media, right? When you have, now technology facilitating our friendships, how are we doing in that way? Are we finding our way towards more social belonging? Are we experiencing more stereotyped threat where people feel themselves to be at risk for confirming a negative stereotype about their social group because of the social context? How terrible. Like we're just as much our own friends as we are our own enemies. And so this is what the science of social neuroscience is really interested in. The Surgeon General talked about loneliness and the epidemic of loneliness. And I just wanted to convey that, isolation may deter brain growth, as Melissa is very appropriately describing. It's also the fact that, we may be experiencing more distress and suicidal thoughts. The loneliness epidemic in South Korea has been related in geriatric populations to, to suicide, higher suicide rates. Why are our elders in South Korea or other parts of the world experiencing higher suicide rates? Is loneliness a factor? Laura, you wanted to say something?
I have a question for you.
Yeah.
It seems that the idea of other gets in the way of, even when you were talking about all of us suffering bad climate and stuff, I perceive that there are people who have power and means who, as long as they feel like, well, it's not happening to me, and they
Right.
don't have a global
You know,
they
yeah.
just huddle together and their brains shrink even more.
Well, I'm going to say something that you may or may not find very friendly, but I'm going to say it anyway because I think it's a provocative, interesting thing or observation. I grew up in Canada where the news was always national or international. And then when I moved across the border to the US, I always found it so interesting. I came as a teenager, and the news forecasts were always about local news first. In the US, we kind of think about local news as kind of really more important than national or international news. That's a real priority of value. And I found that a little bit curious because what happens when we're focused just on our immediate surroundings? We find ourselves really thinking about ourselves, less so about others. There's a concept of racism. If you want to mitigate racism, travel. If you want to mitigate fascism, read. Opening up our minds to things that are not, normative to us is a task that is difficult, just by nature. It's a challenge, and so some of us are more ready for that than others, and so appreciating that is important. I'm going to talk a little bit about specific examples of belonging, and just describe some examples of these threats that these terminologies, so you have a sense of them. Stereotype threat is in which experience in which people are or feel themselves to be at risk of confirming a negative stereotype about a social group. So perceptions of negative stereotypes can undermine an individual's sense of belonging to a domain which they are stereotyped, and then their desire to continue in that domain in the future. So, easy example, girls suck at math. What happens when girls are told that they suck at math? They increase their stereotype threat. They don't feel that they should be mathematicians. They get bad grades, and then they don't pursue careers in math. When we have stereotype threat, and Melissa kind of alluded to this earlier, the learning is impaired during threat and stress. We don't find ourselves inclined then, and our adaptive plasticity, our brain's capacity to respond to that environment of stereotype threat is limited. And as a result, we have slow processing. We don't believe we can meet expectations. That's what prediction error is. We have impairments in memory and attention, and it results in, as Laura was describing before, a defensiveness. That's the interpersonal conflict that can result. And what happens when we don't know where we stand in a situation or a context? We either fight or we flight. And our core basic parts of our brains that are really wired, we have evolved first to fight and flight. Our amygdalas, our subcortical areas of the brain evolve first. It's the regulatory parts of that, brain that come online later. Somebody asked why, it's 5 years of age seems really older for aggression to begin. Of course, it happens earlier. It was sort of an approximation of the idea that really in young childhood, this happens so young. These are primitive things because our basic nature is actually evolved first, in part because we need to be able to fight or flight when we had inclement weather. We needed to be able to survive. Kids needed to be able to cry to signal alarms so that parents would come to run to their care, right? That alarm is part of our survival. So we have that so hardwired that defensiveness is part of our automatic reactions. But it does impair learning because learning is a high order function. It takes the focus of the brain and sequesters it all into that basic fundamental part. Does that make sense in terms of just the overview of how we think about our brains and how they're wired to really be automatic in certain contexts and perhaps much more difficult to engage with high order regulatory processes, because those parts come later, they evolve later, and for some people don't evolve much at all. And so this is what we do in therapy, is we're actually trying to cultivate the high order brain functions. I'll show you how.
Sorry,
what?
Just the opportunity to manipulate by knowing what you just said, the opposite of what therapists do, but to keep people in a fearful state,
right,
makes them so much more vulnerable. And you see that happening more and more, where it's like somebody read your paper and they decided that they're going to use fear to control people.
Right, right, absolutely.
Yeah. So
that's right.
That really is a great explanation. Thank
My pleasure. So here's an example of ambient belonging. So it's not just, Laura, in the person or in the individual's brain, right? Our brain is interacting with an environment. And how do we feel that we fit into an environment is called ambient belonging. It's feeling comfortable in a space, like you are accepted, valued, and included there. And there's a physical space that can actually create that. It sends powerful messages about who belongs. In this, Zoom space, I have massive criticisms of Zoom, because when I present and I do a slide share, all I can see is my slide. There's a window where I can try to see you, but I can't expand it except in a very limited fashion. I have to multitask. And I know they're evolving this a little bit because they have to, because it's a socially impairing phenomenon for me to present to you and not be able to see you all and to know how you're reacting to what I'm saying. But this is also an environment. We create this environment when we are actually doing therapy. I went to Vienna a couple of years ago to see Freud's, I was presenting at a meeting and I had the opportunity to go to Freud's house. And in his office, there was a relic of a mirror. And the mirror was placed on a window, but it was facing his chair. Any ideas why that mirror might be facing him and not his patient? He wanted to look at himself and his own emotional reactions, or lack thereof, to the people he was doing psychoanalysis with, right? What are we doing when we're doing telehealth with our patients in this box? Who are we looking at? I guarantee you, if you introspect about it, there will be moments when you're not just looking at that green dot, you're looking at yourselves or your patient. And that's normal. We do that all the time. Freud did that. We need to be able to look at ourselves. But what is the purpose of that? And how do we psychotherapeutically, I don't love the term manipulate, but you understand the point, experimentally understand what it is that we do and how do we do it? How much airspace do we give to making eye contact with one another in our therapeutic space? And how does that impact the therapeutic outcome? So this is an example of office space. Back when we used to see patients in offices, you can imagine that these different spaces have evoke different feelings or emotions or sense of belonging. And if you look at sort of the experiment in a gender biased fashion, you can see that there are a variety of different reactions, and there may be some gender differences on how we create physical environments based on that. How are office spaces in most places, like relic wise, how were they oriented? How were they evolving? How can we understand that? Okay, so here, people have actually also developed social interventions to cultivate social belonging, not just ambient belonging, where they randomize people to different office spaces, but social belonging, which is a sense of having a positive relationship with others, right? This is the in groups and the out groups, and how do we behaviorally understand the concept of being socially belonged. Uncertainty about belonging can undermine a variety of different performance metrics, and lessening inequality requires intervention. It requires a social belonging. So people have randomized a variety of different students in college to a variety of different majors and what they potentially were doing, and cultivating self-reported belonging based on levels of uncertainty and self-doubt, and found that if you did a randomized controlled trial where you actually used an intervention and compared people who didn't do the intervention, the actual social belonging experiment didn't just impact people in a different way in different control groups, but it had effects in certain subpopulations. African American students felt more social belonging when the intervention was targeted towards helping them feel like they belong. And these are experiments that are well known now, that if you feel like you have social belonging and ambient belonging, your capacity to learn, to be to thrive, to feel like you belong and you have the opportunities that are accessible to you, but are also paired with good mentorship, good support, and a nurturing environment, all are recipes and important parts of how we intervene in academia. I'm going to spend a couple more minutes just on science of psychotherapeutic interventions and what they can inform us. These were my kids, my older two, many years ago. They're now 13 and 12. They're usually very much at each other's throats these days, but sometimes cuddly and cute and cooperative. But we in my lab have used a family model system of people who have a family member with a mood disorder versus not, to understand neural circuit function. And what we found is that people who have a bipolar parent, who are experiencing a lot of stress in the family environment, have higher vulnerability towards disconnections in certain areas of the brain that are really important for reward processing. When we followed these kids and compared them to kids who had a parent with major depression and controls, we did a 5-year study. Some of those kids ended up having mood problems themselves. Some of them ended up being resilient. And we looked at their brain structures, and what we found was in relationship to prosociality, that a correlate of being able to make and keep friends seemed to correspond to more connections in the brain, and more connections in the prefrontal areas of the brain that are really important for regulation. So it sort of lends itself to this understanding that we grew our brains over our evolution, and the high order parts of our brains that we engage and activate when we're training people or observing kids over the course of development, when they grow their brains, their pro-social brains, they're making more neural circuit connections and staving away mood and anxiety symptoms and other problem behavior. It's the opposite is true for the kids who went on to develop psychopathology, is that those kids had more disconnected circuits. So when we made this observation, we wondered, could we potentially intervene by improving neural circuit function through prosociality. Well, how do you do that? Well, we were doing a bunch of psychotherapeutic interventions in a family system, because using the family system as our model, we wanted to randomize kids who had a family history of bipolar disorder to an active intervention that helped facilitate their prosociality and family functioning versus just providing psychoeducation. And what we found was that when you added that prosocial behavior training, communication skills, problem-solving skills, trying to get them to be more effective in a social context, and specifically in the family context, that if we randomize those kids to the behavior training versus just psychoeducation alone, what would we find? And what we found was that those kids who got family-focused therapy did equally well in terms of their relapse rates for mood problems initially in the acute phase as the kids who got psychoeducation alone. 6 weeks, 8 weeks, 12 weeks, 16 weeks, whatever their time of participation acutely, both groups didn't seem to do better. But when you follow these kids long-term, like a year, 2, 3 years out, the kids who actually got the communication and problem-solving skills training did better. They had fewer mood relapses than the kids who just got the psychoeducation alone. So we think actually that there's network changes that relate to this. And when we scanned their brains before and after, we found that the kids who had more prosocial behaviors, more capacity, who were randomized to that training, ended up increasing their neural circuit connections. And that increase in neural circuit connection actually corresponded to decrease in depressive symptoms. So I think psychotherapy plays a major role. And we actually think it's not just a plasticity phenomenon, but we think that there's actually prosociality being cultivated there. There's probably an interaction with medications to some degree, but what does psychotherapy do? It enhances adherence to treatment. It builds a relationship, the therapeutic relationship. So people come back to not just receive care for their behavioral processes, but also any physiological processes that might also need support. So when you think about your social interactions that you've recently experienced and you were able to turn into an opportunity, what kinds of factors contributed? When we have a feedback culture with microaggressions, we need a balance of courage, as was described earlier, as well as grace. I named my kids these concepts because I was so impressed by their importance in my practical and daily life. And still I'm struggling to figure out and scratch my head, why is there such a paradox in academia? And why are we so hardwired to haze and to austerely, convince people that we're superior than others? How can we support each other when we miscommunicate or we get things wrong? Eric, you had something you wanted to say?
I was really kind of going back to a slide before about the importance of the pro-social component, and I was thinking
Yeah.
about so some of the critiques over the diversity training that an organization might have oftentimes are awareness based, and that's it. And I think that's
Right.
the critique in some of that, is that awareness leads to this discomfort and nothing to do with it after that point, which then people get defensive and they write legislation to defund diversity offices because they felt uncomfortable, right? So I guess I don't know the research here, but I'm wondering if this would be something to study in your lab about the idea of awareness only versus awareness plus pro-social intervention
Training here.
in the context of social connection, brain development, and then the ultimate goal, which I think we all have, of the social resilience amidst a history of oppression, whatever ism you might want to add in there. So it just really got me thinking about
Wonderful point.
some of that.
Wonderful point. And I think that that is the opportunity ultimately, is like, so we understand what these processes are.
Mhm.
How do we get to a better place, and how do we question critically how we've done things? You know, there's a long line of critics out there, right? Like they're plentiful. So being wrong and understanding we grow through disagreement is the opportunity, is the chance that we have, but we tend to run away from it because we tend to go along to get along. And some of us need to find a way to be in a friendly way. And there's practical ways to do this that I want to kind of get to, because I think that that's an important, you know, walk away point. The Nurture Effect by Anthony Biglin, who's a prevention scientist in Oregon, is an amazing read, because it talks about how the science of human behavior can improve our lives and our world. And Eric, that's the answer to your point. Like, he's essentially in a monograph described exactly what you're saying, is that we can take these experiments and forward translate them to really important and consequential decisioning if we understand the nature of our behaviors. And this is sort of even to the fundamental point of contrasting being nice, the superficial stuff, the psychoeducation stuff, to being kind. It's not easy to be kind, to really ally and foster growth in people. It also isn't easy to stay in an environment where there's actually a lot of harm and difficulty. But how can we take an opportunity to commit to representation, to commit to transforming our environments, to empathize with the experience of others, and be an agent of change, and use our prefrontal cortices to think, and ask ourselves, you know, if what we're doing is true, helpful, inspiring, necessary, and kind. These are super, super basic things that we can all do. And then there's this really cool book that I wanted to mention at my closing, and I will share my sister's story in the slides. And I really hope you do check out her story in JAMA. But there's a friend of mine, Nir Halavi, at the Stanford Business School, who wrote articles about how, you know, we can actually find, if we can find ways to increase hope, maybe we can decrease that defensive aggression that we tend to orient ourselves towards. So the high order prefrontal process that we need to kind of impact in our environments when we're sort of feeling defensive is, everyone makes mistakes. I can see where you're coming from. All good. All good is a hopeful statement. It is going to be better. No worries. Mitigate anxiety, mitigate stress. We're okay. We're gonna be okay. We're going to find ways to make this better. These are all ways that we can intervene, even with someone who loves being right, but are mistaken and too fearful of embarrassment to confront being wrong. So Cultivating Hope is a story of my sister just before the pandemic. She has Down syndrome and congenital heart disease. And I'll show you the pictures and I'll send you the slides, but she essentially is an amazing human being, who, for all that she potentially lacks in terms of computational neuroscience knowledge, she makes up for in spades with her social affability and capacity. She was nearly died before the pandemic of a common cold, because she's vulnerable, and taught me and my family, but also I hope a lot of people, when they read this article I wrote about her, about how important it is. It's life-saving to work in teams and to support our most vulnerable, and to be more collectivist in our thinking. If we want to go fast, go alone. But if you want to go far, go together. So with that, I'm going to just end, and I apologize, I've gone over a minute, but I hope this was helpful to you in terms of how I orient myself to the world of social neuroscience. And the science really can, I think, help us and create hope.